Hello everyone, my name is Midwife Sally. Welcome back to my channel. On this channel we talk about pregnancy, labor and delivery. We also run a pregnancy class online, so you can always subscribe. We have a book on pregnancy that you can purchase as well. Yes, so today I'm still at the Pampam Polyclinic with midwife Elizabeth. Yes, so she is the best nurse in the Greater Accra region for the year 2019. Yes, and so today I'm here to ask her a question that you moms have asked me. The question is, when can I resume work after pregnancy or after birth? Yes, so Auntie Elizabeth, welcome.
Thank you.
Okay, so let's go straight into. Hope everything is fine.
Yes.
Your hospital is doing well. Okay, so the first question is, when we talk about can women work during pregnancy?
Yes. Once your doctor allows your doctor having told you there's a contraindication why you can't work, you can work during pregnancy.
So what is contraindication?
When there are conditions which prevent you from working. For example, maybe you have a threatened abortion or you started bleeding in early pregnancy. We put you on medication, the bleedings have subsided, but there is a chance that with the least mistake you may lose the pregnancy, or if you do any strenuous activity you may lose your pregnancy. Then there your doctor may recommend that you take some rest.
So that's the only time you may not work.
That is
pregnancy,
yes,
you can work.
Well, yes.
Okay. Yes, so I can confirm that midwives, nurses, doctors, everybody is working. Even if you go to the village, you see the women working. Yes, so I had an important question. That's why I wanted us to clear that out. When can women resume work after giving birth?
Okay. So after giving birth, we must all know that the process of labor and delivery is a strenuous one. And after giving birth, you need adequate time to rest so that your body will get back into shape before you start doing active work. Normally, it's recommended that by 6 weeks after delivery, for most people in general, by 6 weeks after delivery, at least by then you would have regained much of your strength, so you can start work. But on a large basis, we can go up to 12 weeks.
Up to 12
weeks, which is 3 months.
Okay.
But all this is also dependent on your doctor. If maybe there were some complications during the labor, then your doctor may recommend that you may have to wait a little while or extend the time you need before you start work. For instance, in our setup in Ghana, for instance, if you are given maternity leave and you went through a cesarean section, at times 2 weeks or 10 working days is added to your maternity leave because you had a bit of a complication or you didn't go through the natural birth. So you may need more time to rest than the one who went through natural birth.
Is it done? Is it in practice?
Yes, it is in practice, and most of the times too, it happens that maybe most people don't really know about it. But if you request for it, you will be given.
Yeah. Okay, so that's for somebody who is working in the
formal sector. And for those of us in the informal sector, it's still recommended that you still rest. For little household chores like walking about, even with cooking and other things, we recommend maybe you wait a while, regain more strength, then you start. But for walking, climbing stairs, other things, there are things you can easily do. We don't recommend you do any work that you may be lifting heavy things. If you are in the informal sector, it's still recommended you still rest for at least 6 weeks.
So at least
6 weeks. By then you'll be strong enough, because once you start working earlier, at times you feel I'm selling. Oh, my customers may go. So 2 weeks after birth, let me go back and be selling. But remember, now you have a new baby who is demanding. You have other babies to take care of. Now you have a business to run. And that will put more stress on yourself. And it may not end well for you. So we recommend that try as much as possible. Get support person so that you can have the needed rest you need.
Okay. So let me add this. A lot of women, sometimes, do we really need to prove to anybody that we are strong? Like after birth, the person is feeling so strong, so she wants to do everything in the house, or no rest, like go back to everything.
We are not in a race. I would say we are not in a race. We are not in a competition. We don't have anything to prove. The most important thing is to get well. At times I understand, maybe you don't have anybody to support you at home. The demands of your work forces you to start doing those things. Though there are few ones who feel I am strong. It is true, you may feel strong, but it's recommended now you realize your uterus or your womb, which was way down within your pelvis, is now up. It needs time to go to its former place, and that will take about 6 weeks. So if you start doing heavy things, lifting heavy things, you realize you may expose yourself to other dangers you did not want. So we recommend, even if you are the person who feel, I'm Marijata, I am strong, please try as much as possible and have some rest.
Okay, very important. Yeah, so let me talk about this scenario. I had a lady who was working in a government setting, but she was not like formally employed. I don't know how they call them.
A casual
Worker. And she said she told me about how she had to hide her fresh baby, like just 1 week or 2 weeks, bring the baby to work and hide the baby so she could keep her job. Like in such situations, like what can we tell employers or like policy makers? Because she's a casual worker, is she still entitled to rest, or working with the private sector or working with somebody in the private sector? Is the person entitled to all the maternity leave or that kind of rest? Because she needs to keep her job. She said if she didn't come, she would have lost it. So she had to hide her baby and be working with 2 weeks.
That's let's say, I would say that's a bit unfair on her side. I don't think she was being treated fairly, because everybody, irrespective of the fact that you're a casual worker or a permanent employee, you still need to be given maternity leave, irrespective of whether you are a permanent worker or a casual worker, irrespective of whether you are working in a government setup or a private setup. But at times these are employees feels I'm losing money, so then you have to come to work, and she can take it up with the relevant authorities and they will come to a aid. No matter whom you are, you still need that maternity rest, because our employees should also know that if you let such a person come to work and she breaks down, then now who works for you again? So she needs to regain her strength and come back and work for you.
Okay, thank you. Finally, I want to ask, what jobs do you advise that pregnant women or nursing mothers avoid? What kind of jobs?
So for our nursing mothers, we advise, even pregnant women, we advise don't do anything which will, first of all, put strain on you yourself. You know your limits and you know the things you can do. So if you are doing something and you feel, this one is above me, first of all, stop it. Then also, we don't do heavy lifting.
Okay.
At times we see our women, pregnant women at the marketplaces carrying heavy loads. I know you need the money, but that is not the very best for you. Doing these things may affect you in one way or the other. So we try as much, please try. Don't do heavy lifting, especially. If you were a nursing mother and you lift anything at all, whatever you are lifting shouldn't be heavier than your baby. That's what I was saying.
So in conclusion, what's your advice to women? When should they start work?
So in conclusion, I will say that ideally after delivery, please wait 6 weeks after delivery. By 6 weeks, you'll be strong enough to start your normal duties again. Thank you.
Okay. Thank you so much. My name is Midwife Sally. Keep watching this channel. Invite your friends to subscribe as well. Yeah, so we are going to the next topic. We'll be going to the next topic. See you in the next video. Bye.